If you have ever had one of your fingers get stuck in a bent position and then it snaps straight, you know about trigger finger. And how can you be sure, what it is exactly and what you can do about it? Dr. Megan Krosmer is a surgeon at Orthopaedic Specialists. And Dr. Megan was just telling me it's one of the most common things she sees.
Yeah, I see this kind of multiple times a day. So it's when the tendon, so that connects your muscle to your bone, gets inflamed. And as your tendons run down your hand, actually right in this area here, they start running through a tight tunnel. So if you have inflammation in that tendon or inflammation in that tunnel, it gets stuck. Yep. Okay. So it can be very painful. Some people will get catching and locking. Sometimes even the finger gets stuck completely down. So.
Well, what does it mean when the finger is bent the other way? What's that? Is that something, is that trigger as well?
Yeah. So normally the finger can kind of get stuck down like this. And that just means that that tendon is just stuck in that sheath. So. And
then you snap it back. Is that the part that hurts?
Yeah. Or getting stuck down can be pretty painful too.
Right, and you see this a lot. So why do you think it's so common that tendon does that?
Yeah, so it's just the area that it's kind of moving. So we see it more commonly in people that are using their hands frequently, people with diabetes or inflammatory disorders like rheumatoid arthritis or lupus can be more prone to it, but I certainly see it in a lot of people that don't have those underlying conditions as well.
Is there such a thing as a mild case that's going to go away on its own?
Yeah, so some people will just get a little bit of mild tenderness in the palm, or they just have a little bit of catching or clicking that's not necessarily too painful. So a lot of times if that happens, we can kind of treat it with anti-inflammatories. There's a topical anti-inflammatory called Voltaren gel, which they market for arthritis, but it actually works pretty well for a more mild condition like this.
Does it? Voltaren, okay.
And then on Amazon, they sell like trigger finger splints, so they basically just hold your finger straight. I've heard of some people actually taping popsicle sticks to the finger to keep it straight at night so that it doesn't get stuck down. So for more mild cases, sometimes that can work.
So, but when you decide, I want a permanent fix and it's really bothering me and is not getting better, that's when they come to you as a surgeon. And so what do you do to fix that surgically? Yeah,
so good news on this part for people that are surgery averse is that the injections can actually completely cure this. So steroid injection,
Oh, so you're not going to cut?
No, not at first, no. Okay. So a steroid injection can completely get rid of this about 60 to 70% of the time. And for some people, it kind of helps a little, but they still have a little bit more symptoms. So sometimes a second injection can actually be quite as effective as the first one. Usually if you get two and it's still happening, that's kind of when we start thinking more about surgery for it.
So it is a shot, and you do it in the palm, the area you showed us?
Yeah, yeah. Usually I have a little trick that I kind of actually go in the crease instead of in the palm, so that makes it less painful. So there are certain things that I do. I can't tell all my secrets, but
don't give away your doctor's secrets.
But yeah, there are things that I do to try to make it less painful. I've actually had patients that have had it done elsewhere, and they're like, "Wow, this is so much better." So
look at you.
Yeah. So we try to do everything we can to keep people comfortable while we're doing it.
Doing a shot without pain.
Well, I wouldn't say without pain, but
your reviews can come back and say less pain.
Yes, for sure. Yeah.
So this is something probably some people have suffered with for a long time.
Yeah. I mean, some people have had it for a few months. I've had some people that come in that they've had it for a few years. So
if they have had it for a few years, is it harder to treat if it's been there longer?
Sometimes, yeah. And also in people with diabetes, sometimes the injections are not quite as effective. We usually still use them first because it usually still can work. So I usually try at least one, and then we kind of see where you are after that.
Okay. Well, Dr. Krosmer was telling me this is one of the most common things she fixes.
Yes.
At your place. Kids get this too?
You can have a congenital trigger finger, most commonly within the thumb, but more common in adults.
Okay. Yep. Okay. So Orthopaedic Specialists, osquadcities.com is where you can go. Dr. Krosmer, and how many docs do you have there? How many surgeons?
I think we have about 6 now. So.
Oh my goodness. Yeah. There we go. Right here in the Quad Cities, trigger finger and other things. And she says she's especially busy because all the deductibles are done.
So being met this year.
Come right on in. Yeah. Thanks, Meg. It's good to see you.